I noticed one time when I was eating that I couldn't open my mouth all the way. It would only open about halfway.
He said it would just happen all on its own. It was a complete puzzle.
It happened maybe several times in one day. After a few weeks, I said, well, I must be clenching down on it awfully hard. It was very strange not being able to open my mouth fully. It puzzled me why my jaw would behave that way. I thought it was just plain old stress, having to deal with constant pressure of having to have computer networks working at the time made me stressed out.
Concerned, Noel makes an appointment with the dentist, who diagnosed him with TMJ, or temporomandibular joint disorder, a condition in which the joint that connects the jaw to the skull becomes inflamed, usually as a result of a patient clenching their teeth.
The dentist suggested that Noel use a mouth guard at night to stop him from grinding his teeth. The dentist told Noel that sometimes it would take years for these kinds of treatments to be effective.
My jaw would just be clenched so tight it would be painful and cracked right through the night guard after a few weeks. What I found was if I would put a toothpick between my teeth and kept it there, it would help stop the jaw clenching. It was not exactly a professional way to move around, but it was helping me be more comfortable.
He said without that, he was biting his tongue and he was biting his cheek, and that the toothpick seemed to trick his muscles into not spasming.
Noel does his best to work around the uncomfortable clenching. But that winter, Dawn is alarmed by an astonishing new development. With every passing month, Noel's pain becomes less manageable, and it starts to affect his productivity.
The pain in his neck and his back became so profound that he couldn't work. He was in so much pain that he would have to lie down to take a nap just to get relief.
I would have to rest maybe an hour, 2 hours or so, just long enough for me basically to recharge. I wasn't happy that I had to resort to resting and being flat on my back to help deal with the pain.
Noel was the kind of person that would just go, 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 go. And to see him need to stop and rest was a big indicator for us that there was something really wrong going on.
Dr. Alcalay also explains that when Noel kept something in his mouth, it wasn't just a coincidence that he found relief.
One of the surprising things about dystonia that we as physicians cannot explain is what we call sensory trick. We don't know why it happens, but touching an area that is affected by dystonia can improve the movement of that affected body part significantly. We actually use sensory trick in our neurological examination to confirm a diagnosis of dystonia. Sensory trick will not help other neurological conditions, it helps dystonia.